Hi, everyone. This week, my soap note is about a patient who came into the office. She's a 65-year-old Hispanic female. Came in because she had this neck mass on her left side. She had this neck mass, I believe, a year ago. She had it evaluated. They had ordered a CT scan and noticed that it was either like wrapped around her carotid artery. Um, and I believe there was a biopsy that was ordered, but she never got it. I guess this mass on her neck is now kind of bothering her a little bit more. She says that, every now and then she'll kind of get like the sharp pain to it. Um, Her range of motion is getting a little bit limited as well. She does not say that it's increasing in size. When she touches it and presses on it, she says there's no pain. Um, Usually, if a patient had come in with this new presenting type of neck mass that was never checked as far as a CT, we would probably do more of like testing to see if it's like something viral or bacterial. She may have had like some type of infection going on. But because we know she's had this for a long period of time and it was already evaluated on CT scan, um, we're going to kind of take a different approach. So, as far as patient history, she has a history of hypertension as well as diabetes and COPD as well. She is not a smoker. She does not use drugs. So, as far as major risk factors for some type of like cancerous malignancy, um, she really doesn't have high risk for those. Um, because she's not a smoker or anything like that. As far as my examination, when I went ahead and looked at the mass, so it's right on it, right on that carotid artery. So it's about maybe this big in size. Initially, when you palpate the mass, it's pretty soft. It is kind of movable. But when you kind of palpate it a little deeper, it was a little bit firmer and harder as when you palpate deep. I checked her entire neck area. There was no other nodules or masses, so everything else seemed fine. If it had been, somewhere more, right in here, we can suspect more of like laryngeal stuff or thyroid issues, but we still, wouldn't want to rule it out. But it is more, you can clearly see it's right around that carotid artery. Um, so, as far as what we're going to do for her, um, we well, let me first tell you our differential diagnosis. So there's quite a few things that it could be. Um, like I said, if it was a bacterial or viral infection, it could be like an ear or sinus infection. It could be a dental infection that kind of travel down, strep throat, mumps, things like that. So we're going to rule it out just because she hasn't had any fevers or anything like that, and she has had this for several years. She said she's had it for at least 5 years. So we are going to go ahead and have a benign tumor on our differential diagnosis, as well as a cancerous or malignant tumor. We can still have thyroid cancer, salivary gland cancer. It could be, when I did my research on masses around the carotid artery, some of the differential diagnoses were anterior venous fistula, an angiomatous tumor, and a paraganglioma. So those would be on the list of differential diagnosis, as well as an aneurysm. So what we will do for this patient, we will want to go ahead and order another CT scan. That way we can evaluate if there's been any changes from the previous CT scan because it was a year ago. We want to go ahead and order that CT scan. We can, and you want to go ahead and do that with contrast. We also want to do a fine needle aspiration so that we can biopsy the fluid inside of the mass. Um, we will not be doing that in office, only because it's probably gonna, it might need to be under visualization because it is around that carotid artery. Um, we will not be able to do that in office, so we'll have to send her to a specialist. But basically, if we were gonna, if the mass was not, around that carotid artery, if we did a fine needle aspiration, we could analyze the fluid. So, if it was any blood in the fluid, it would be more of a vascular lesion. If it was a dark brown fluid, it would could possibly be a papillary thyroid cancer. If it was a thick, viscous yellow fluid, it might just be like a mucocele, or a turbid yellow fluid, maybe a brachial cleft cyst. And then if it's purulent, it could be like an abscess. So those are the things I found when I was researching neck masses. So other than the CT scan, what we're also going to want to do is we're going to go ahead and refer her to an ENT, just so they can they might be able to visualize the mucosa of maybe the pharynx and the larynx more, with a video assist. And then we could also refer her to a otolaryngologist as well. We can go ahead and do some studies, some lab studies. We're going to want to do a CMP as well as ESR, to check for any systemic inflammation or infection, just to make sure, she hasn't progressed an infection or anything like that. We're also going to do we're going to do, what I meant is if we had suspected an infection of some sort, we could order an ESR, we can order blood cultures, Epstein-Barr, and HIV serology, just to check for infection. But because we already know it's probably not infection, we're not going to go ahead and do any of those labs. But I just kind of wanted to throw them out there so you guys are aware of that. So, we, as far as education for this patient, we really stress the issue of completing her referral to these specialists, because we need to check if this cyst or this mass has grown. And we really, really need to do that biopsy because it can be cancerous. So we really stress the fact that, she needs to do that. So other than that, there's not really any major treatments that we provided. We just let her know that she can take some ibuprofen if she feels any pain around the site, just to maybe bring down some inflammation. But she didn't really complain of too much pain. She did complain of a sharp pain. So we can also refer her to a neurologist, just to make sure it's not being affected in any nerves, because of that sharp pain. So she denies any numbness, tingling, or anything like that. But every now and then she'll get the sharp pain. So, it's definitely safe to just refer her to the neurologist and make sure there's nothing going on there. So yeah, that's my SOAP note for the week.